I'm Dr. Rajeshwari, one of the consultants at Gunasheela IVF Center. Today I'll be talking to you regarding the myths around infertility and IVF treatment. Infertility is not a disease. 1 in 6 couples do have difficulty in conceiving. Infertility is associated with a lot of social stigma, very stressful to couple, very expensive, and insurance does not cover the expenses of IVF. Couple, in order to achieve a pregnancy and have a child, are ready to accept advice given by anyone and everyone, which may not be medically proven. There is a general belief that going in for infertility treatment gives them 100% guarantee of having a child, which is not true. Success rate will depend upon the underlying cause for the infertility, and it varies from couple to couple. There is also belief that the injections given during ovarian stimulation in IVF causes a lot of problems to the lady. Yes, there is short-term problems like ovarian hyperstimulation, but there is no proven long-term complications associated with the hormone injections given during stimulation. There is also a misconception that the stimulation done during infertility treatment in IVF reduces the ovarian reserve. It is not so. During natural conception, of the full cohort which comes in for the race to mature, only one matures and the rest die. We, during infertility treatment, aim to mature these dying follicles so that we get many number of eggs. There is also a general belief among the couple that there is increased risk of abnormalities in the babies born through IVF. There is no proven evidence to say that there is increased risk of abnormalities. In the general background, it is around 3 to 4 out of 100 babies do have abnormalities, and in IVF it is around 4 to 5 out of 100. There is no significant increase. Majority of them are normal. There is also a misconception that going in for IVF gives them a male child. There is no scientific or proven evidence to say that yes, infertility treatment gives them a male child. There is also a misconception that there is seasonal variation in the success rate of infertility treatment. No, there is no such evidence to say yes, during different part of the year we get different success rate. Couple have a lot of doubts regarding the do's and do nots post embryo transfer. They have many questions whether they have to lie down straight, whether they have to be in strict bed rest till their pregnancy is confirmed, should they climb stairs, should they use Indian toilet, or what type of food to be taken. There is no medically proven evidence to say that strict bed rest increases the pregnancy rate. We only tell the lady not to do any unusual activities like going over a bumpy ride, going for aerobics or gyms after the infertility if she is not doing it previously, because during stimulation the ovaries can enlarge to a certain extent, and when you do such activities like aerobics, there is chance of the ovary twisting and causing a lot of pain, and which may require treatment. And we also ask the lady not to take a lot of hot and spicy food, because post embryo transfer we give them hormones like progesterone, which causes them to have a bloating sensation, and this hot and spicy food may aggravate all this constipation, gastritis, bloating sensation. That's the only reason we ask them not to take hot and spicy food. And also during pregnancy there is a chance of increased thickening of the blood and clot formation in the leg, which may be dangerous to the lady's life. That is the reason why we say stay as normal as possible. Do all your day-to-day activity, which is a misconception that they need a strict bed rest. We as clinician would advise the lady to be as near normal as possible, attend to all her normal day-to-day activity, and if she is a professional woman, we would advise them to continue their professional work during stimulation as well as post embryo transfer. We also encourage the lady to go for meditation and breathing exercises which may help her to reduce stress and be positive about her result. Thank you.